Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name's Colin Manifold. I was born and bred in Staffordshire at a little village called Orrewas, but moved to Leicestershire, to Measham in northwest Leicestershire in 1987, where I've lived with my wife and my son like ever since. I've worked for a company in Burton-on-Trent as a sales representative for over 32 years. Thoroughly enjoyed my job, been very work orientated, very money orientated, because it was a sales job. We were paid on a commission based process, and my wife's always worked as well. She works for the local authority. We I've got one son, Liam, who's is currently just coming up to 21 years of age, and he's an apprentice electrician. He'll be fully qualified in the next few months. I haven't got no immediate family. My mother and father passed away 10 years ago. My mother was a nurse in her profession, and my father was a mechanic. And I'm the younger of three sons. I've got two brothers. Both live in the Midlands. I was diagnosed in June 2012. In the summer of 2012, I initially found a small lump the size of a pea in my thigh, the middle of my right leg, and went to my doctors, my local GP in Measham, where they were very thorough and prompt, and sent me for an x-ray straight away to Colville Hospital, where I had an x-ray and was told 5 hours later that I got an osteosarcoma in my right femur.
Colin, thanks for coming in to spend some time with us here on the Cancer Stories programme. We're very interested in hearing from anyone, particularly like yourself, who's got a less common cancer. And yours is an osteosarcoma, isn't it?
That's correct, yes.
I heard you say on the intro a little bit about how you were diagnosed, but do you mind telling the viewer in a bit more detail how it came about?
Mm-hmm.
For example, were you well at the time
Yes,
things started to develop.
I was perfectly well. You know, May, June 2012, I was working, busy at work, where we're always busy at work, so no issues, and you know, my health was fine, and just found this little lump one day in the shower at home, as I said, the size of a pea, no bigger than a pea, and no pain from it whatsoever.
Yes.
I helped out at like a local community event back in June, which was the Queen's Jubilee. I helped out at my local leisure centre, so I was on my feet all day. And when I got up on the following day, I had an ache in my thigh. So consequently, I made an appointment to see my GP, and the rest's history, as they say. When I walked in, the doctor seen this lump and said, "Look, can I go for an X-ray straight away?" And I had the day off work. I was on a rest day, so I went for an X-ray, and I knew straight away when I walked into the X-ray unit. I was on my own. It was 11:30 on a Tuesday morning, and there was me and like the one lady. I had some X-rays done. Excuse me, about 10 minutes. And ended up eventually with 4 people around the screen looking at my pictures as such.
Yes.
And I knew then when I came out of Colville Hospital and I drove home to Measham, I knew there was something wrong, but I didn't think of the cancer route one bit, to be honest with you. I thought hernia, some injury from when I used to play football when I was in my teens.
Yeah.
I didn't think of a sarcoma. I didn't know what sarcoma was at that precise time.
Yes.
And then as the day went on, I just got through my day. My family came home and we were having a meal at 5:30. The phone rang, and it was my doctor to tell me over the phone I'd got a problem. Yeah. Quite a serious problem. But I knew my doctor personally. We were on first name terms, so that was great, and I'm glad he did. And consequently, I went the following day to see him, and he said what he got to do from a GP's point of view. He'd have to point me in the direction of Leicester, the cancer unit at Leicester Royal, which he said I'd be in good hands, and to tell me employers, that I wouldn't be coming to work for a while. Within 2 weeks, I got a letter from Leicester saying to come in to see Dr. Ashford, which I did, and I initially came in as an outpatient. Dr. Ashford told me that he was unable to do the operation here in Leicester. I would have to go to Stanmore, in Middlesex, which is the National Orthopaedic Hospital, which I specialise in.
So it was sufficiently complex or specialised that you couldn't be treated even in our regional centre. You had to go to a kind of national centre.
I did, yes. I think Dr. Ashford, he mentioned 4 hospitals in the country that maybe could do this operation. I think one was Glasgow, Bristol, but he said I'd be better off in London because he knew some of the staff in London. So I got an appointment to go down to see them in London at Stanmore, just down the M1, as the doctor said. He said it's not a problem, it's only 2 hours down the M1. So we went down, several appointments, went down to see them, and came under the umbrella of Professor Tim Briggs's team, which I was quite pleased about, down at Stanmore, because obviously when I was diagnosed, I became very interested in my treatment and the route I was going to take.
I see.
I did take great interest in that, so I took a personal interest who was going to be on a one-to-one basis with me.
So does that mean you were somebody who would try and gather more information? You'd actually ask for information or look it up. Some people, they prefer to leave it to the medical profession. Some people prefer to gather as much data and information as they can.
No, I like to be involved with my treatment from the start, and I did try and gather as much what was going to happen to me. And when I went when I went and seen Tim Briggs, he said that, you know, I'd have to go in for a biopsy down to London and have x-rays and, you know, a CT scan.
Yeah.
Lock up here at Glenfield, which I did.
Do you find that attitude of gathering information, being involved, keeps you in kind of good stead in terms of dealing with the illness? Because in a way you've got a little bit more control over the situation.
Yes, I found it to my personal best to, you know, to go down that route.
Yeah.
I got onto first name terms straight away with the people at Stanmore. I didn't want it to be us and them. I was the only one there from the Midlands, although there was patients there with similar problems. I didn't see anybody who got a sarcoma on the leg like me, but people had, you know, similar problems with sarcomas in other parts of their body.
Yeah.
So I was involved with people from all out the country, you know, from all over the country.
Yes.
You know, Stanmore takes in like a wide area.
Yeah. Now you haven't said, but I'm sure you will. What was the difficulty with doing the operation? What was the technical challenge? What were they trying to preserve, if you like?
Look, after I had my biopsy down at Stanmore, Tim Briggs said to me that, you know, I got a tumour on my thigh bone, and there was no other option to remove the thigh bone and have a replacement thigh bone and like half a new knee.
Really? Because
it had like eaten into my thigh bone.
Yes.
And the top half of my knee. So that was the route I had to take. You know, I trusted the team down there, and they said that's what had got to be done. So I had no option really, but I was very interested in what they were going to do. I wanted to know what was going to be replaced with, and how long the operation was, and how long the treatment was going to be. And I can remember Tim Briggs saying to me, like, tell your employers you're going to be off 6 months.
Yeah.
And I remember turning to him and, you know, and saying, 6 months, you know, I can't have 6 days really, you know, sort of thing, doctor. No, he says, you're out the system for 6 months, and he says, I will get you right.
Yeah.
He says, I can do the operation, it's specialised, it's a big operation, but he says it'll involve 3 months chemotherapy at the start, and then your operation, and then another 3 months chemo after the operation.
I remember you mentioning to me your surprise at needing to take such a long time out. It sounds to me like you were fully anticipating going back to work straight away. I did.
You know, I just thought it'll be an operation, replacement of my thigh bone, 6 or 8 weeks, and I'd be back driving me van as such, you know, at work.
You were fully, working. You had a busy job at that time.
I did.
Who were you working for? What was the role?
I was working for a company called Kerry Foods. It was like a van sales role, like going around food retailers and outlets, selling food basically off the van, you know, and we're a big company, a multinational company, but it was, it was like a classed as a sales job.
Yes.
You know, you were paid on commission and you had targets to reach and all that sort of thing.
And with that kind of job, you're particularly involved in, getting out there and doing your role, isn't it?
That's right.
Particularly with a commission, where if you don't go, you're not really going to earn the money.
That's right.
So you in your mind, it's linked with getting out and doing something.
Yeah. Plus the fact you were meeting 300 to 400 people a week.
Really?
You know, you were meeting hundreds of people a week.
All those contacts.
You had a big base to selling. You weren't just doing shops, you were doing hospitals and motorway services, and you really had to be an approachable person to do the job.
Now let's come back to the operation itself. So they were replacing your thigh bone, the femur, and they were operating also on the knee. I believe you told me that if you hadn't gone to Stanmore, you might have been facing an amputation.
I may have been, yes. That was mentioned at, at one point. I think if I'd have been having this conversation with you 10 or 15 years ago, I would have had that leg amputated. But due to progress, as it's gone on, I'm here to tell the story, and I've still got my leg, and my leg's going nowhere. It's just going to get better now. I know it is, and I've had the operation now and moving on. But
so what did they do with the bone and the hip and also the knee?
I had a titanium rod, as I call it, put in, which is connected to my hip via a disc. I call it a CD, and then that's packed with polystyrene, believe it or not, a small little pack of polystyrene, which is then put onto my hip bone, which is now titanium. Sorry, not hip bone, my thigh bone,
Yes.
which is now titanium, and they cut half my knee away and made that titanium as well. And then I had 2 3-inch bolts or screws put in the back of my knee into my calf to hold the structure up, and that's also based on thin polystyrene. The polystyrene over a period of 8 to 10 years will have to be replaced. I will have to have a replacement of polystyrene in about 9 years' time, they said, but that's not a concern to me at the moment. I think that's just a standard operation to replace it. So it's all packed in there. My biggest issue is with the operation. I've lost a lot of nerve. I've lost all my soft tissue at the top's gone. A lot of muscles gone. That was cut away, obviously, and it takes a long time to rebuild.
And just to clarify, the tumour itself, was it arising from the bone?
Yes, it was on the bone. It was arising from the bone. Like when they took it away, Tim Briggs said it was the size of a fist. It was a lot bigger
than it felt on the outside
when they got into it than it was, from the outside.
And did you ever see a picture or an image on the scans? Did you see,
Not of the tumour, no, I never have. I've seen all I'll call me x-rays after, of my leg as it is now.
As it is repaired, yes.
As it is repaired now, and I can know, I know how my leg works now, and I know it will get better.
Now, it sounds pretty cutting edge, all of that procedure. Is it a very new thing that's come along, as far as you know?
Yeah, as far as I know, I think it is. It's still a major operation and a big operation. It's, a 7-hour operation to do that. And I can remember being in theatre when I went down for theatre to have the operation. Tim Briggs came in, and I was just like going under my meds. And he leant over and says, when you wake up, make sure you wiggle your toes, because he said, if I have problems in the operation, like Colin, I'll have to remove your leg, obviously. I'm not going to wake you up and then come back and remove your leg, he says. So, but he says, all being well, I'll be able to save your leg, he says, but it's not an easy operation. So I put my faith into them down there at Stanmore, and it paid off. And then when I came round, that was the first thing I did. I wiggled my toes, and they were there. So
it was in your mind to do that. And
yes, it was. Yeah,
everything was okay.
Everything was okay. I went into eye dependency for 2 days down there, and then I went on a ward for 10 days when I was discharged to come back up here, to come back into Leicestershire, back home.
We heard there about the operation, and that's very fascinating about the details of what happened in theatre. But often one of the biggest challenges is what happens next, the rehabilitation, the recovery as well. And what do you remember about that early period where you were perhaps heading home, and the advice you were given, and what came next?
Because I had my operation in Stanmore, I had to go under their umbrella as such and have my initial physio back at London. So it was a case of when I got discharged from, not discharged, when I came home from Stanmore initially, I came home as an outpatient and was told to rest for 4 weeks with my leg up on a poo for a coffee table, but I had to keep it elevated at all times. That was because the blood functioning, getting the leg back to normal as such. And then after that period, I had to come back into Leicester Royal for some chemotherapy, but also on top of that, I was going back down to London to have physio as well. So it was a very, very intense time, busy time, and very, very difficult time. Yeah.
Do you remember the advice you were given in terms of what you were allowed to do and not allowed to do?
Yes, I do. Yeah, I couldn't really do a great deal from being an active person and out and about all day and driving and enjoying life as such, and being open-minded to come into a, how can you say, like a cocoon really. Yes. where you can't get out of it because you've had this operation and I couldn't move forward, and You know, I'll be honest, it took a long time for me to get my head around that, but I did eventually, but
Yes.
it's a very slow process.
We'll talk about that in a bit more detail in a second, but just in terms of the leg and what the effect was on your capability to get about, I imagine with the extent of the soft tissue involvement, you know, the operation, that there was quite a lot of weakness there or immobility in the leg.
There was, yes.
Can
I
you
couldn't
describe what the situation was?
Yeah, it was very difficult to get around the house. You know, I was on crutches, but I was also in a bit of pain at that time. I was, you know, on morphine to get rid of the pain, but I was reliant on other people as such. You know, if I went out to hospital, you know, if I had to come to Leicester or, you know, down to London, I was reliant on, you know, friends to bring me, or, you know, the WRVS were very good with their service. They were excellent. So I had to use that, you know, and I can remember there was one day like I had to come down to London for an outpatient appointment about 2 months after I'd had my operation, and I had to have an ambulance to take me to London.
Yeah.
And EMAS, you know, they were very good, and you know, they took me down to London in the back of an ambulance. Me and my wife, and you know, with an ambulance driver, and went all the way down the M1 with my leg up in the air.
Yeah.
In the back of an ambulance, but you know, and then wheeled me into there and brought me home safely.
Yeah. Well, it just shows you how severe things were for you, even in that early recovery period.
Yes, they were, yeah.
Did it ever get frustrating that you were being held back? I know you were improving, but obviously you had that setback. Or were you looking at it more positively, like, well, they've treated the cancer and therefore it gets better from here?
When they took away the tumour, like I was told that there was only one thing to worry about with a sarcoma in my case. If it ever came back as a cancer, it would attack my lungs. So they said that, you know, I've got to come back into Leicester every 3 months and have an x-ray on my chest.
As a checkup?
You know, as a checkup, which I am doing. But it did restrict me from doing an awful lot. When you haven't got your legs and you can't get around, I couldn't drive.
Yes.
You know, I didn't drive for 3 months after the operation, you know, and I'm rarely, got outside.
And that was part of your career, wasn't it, driving?
Part of my career was driving. I used to love driving. I was up and down, the roads of the Midlands all the time.
Yeah. So it must have been odd, just being limited to staying at home for so much.
Most definitely. Most definitely. My wife took 7 weeks off work after the operation to look after me.
Yeah.
You know, she was a rock, to be honest with you. Without my wife, I wouldn't have.
What else helped with the rehabilitation process? That is the process of trying to get back your function as much as you can.
I did exactly what I was told. I didn't do anything out of what I was told. When I was told to do something, I'd do it. You know, if I was told to bend my leg or try and bend my leg, I'd do it. If I was told to rest it, I'd do it. I've done everything that the physios have told me to do.
Yes. You kept to their exact instructions.
I've kept their exact instructions, you know, both at home and in hospital.
So you had physio. I mean, roughly how much and for how long? How many weeks or months of physio?
I've had nearly 10 months of physio now.
Right.
After, since the operation.
So very intensive physiotherapy. Did you have any other input from allied health professionals? Occupational therapy, for example?
Yes, I've had that down in London and Stanmore.
What did they do for you? Do you remember?
Well, after the chemotherapy, I lost all sensations in my fingers.
Yeah.
And in my feet, in my toes. My fingers have come back. My toes haven't, unfortunately. My feet, feel cold all the time. But OT really worked on that, and they give me lots of things to do. Put my hands in a bowl of sand, or have a ball in my hands and keep squeezing it, which I did, and that's come back.
Yes.
That's fine.
Do you think that's partly a testament to that rehabilitation?
Yes. Oh yes, most definitely. Yes.
Yeah, that's good. I hadn't heard those tips before. I like what you're saying there.
Yeah.
We could use that for other patients.
Yeah.
So you had physio, OT, anything on the emotional, psychological or supportive side?
From an emotional side, I used to get, really upset in my head, because it put me back from what I really wanted to do in life. You know, everybody's got, you know, plans, what they want to do, and, you know, holidays, and, you know, you want to do this with your home and all that. And we both had, you know, certain things we wanted to do. We wanted to go to America on holiday, and which, you know, we've not been able to do you know, at this moment in time. But yes, me head really went in the, you know, in the clouds, as they say, to be honest. But I had help from my local GP then, and I had to go on to antidepressants. I'm still on antidepressants actually. You know, 12 months later, and I found them very, you know, very helpful, because you can really get down.
Yes. I'm interested to hear what you said there about low mood and also depression, because it's one of those symptoms that perhaps isn't talked about enough, but it affects a lot of people, probably at any one point in time, with people who are within a year of their cancer, probably about a quarter of people. So it's a significant problem.
It is, yeah. It was a big problem for me, to be honest with you. You know, I've had some really grey days, as they say, but you've really got to be focused, like on coming outside the other end of the tunnel, if that's the right word. And that's where, you know, I tried to get my mind set all the time, but unfortunately, being a male and being a, you know, like a young male of 54, if that's the right word. You know, I used to work with younger people, so I was always upbeat, always talking about, you know, something at work, and, you know, being involved with other people. And then when you took out that, like, cocoon, and you come in the hospital cocoon, and then eventually, you know, I had all my treatment, and then, you know, one day it comes to the point where my wife's gone back to work, and I'm on my own, like at home, you know, sitting, like, looking at four walls, and that's a real major problem.
I totally agree with you that period where you're discharged and then the input is less from a clinical or professional point of view, and perhaps your partner isn't always around, you suddenly can feel at a loose end. Now, you've already, you know, kind of changed your role by necessity from that full-time working person. But in addition to that, you've got your rehabilitation to contend with, and the background worries about your illness. That combination is quite a difficult one to handle, I think.
It's very much so.
What kind of symptoms were you getting? Symptoms of things like, you know, were you worrying? Were you low? Were you concentrating too much on bodily symptoms?
I wasn't too concerned about my cancer, if that's the right word. I was more concerned in what I was going to do, perhaps from a financial point of view at the end of the tunnel, because, you know, I knew work were very good with me. You know, I was getting paid initially, you know, at work, but, you know, at the same time they were ringing up and saying, like, you know, what, when you're going to come back? And, you know, I was saying another month, because, like, they had to employ somebody to take my place, so in effect they were, you know, paying double for my job. And that was always at the back of my mind, what I was, you know, the financial aspect of it. And really, it's not a problem. You know, finances, you shouldn't have to worry about your finances, but unfortunately you do. You know, it's part of the course. Everybody's got to pay their bills, whoever you are.
Definitely.
And
so you were worrying about the financial situation, and
yeah, I was worrying about
about going back to work as well.
Yes, and then, you know, and then on the other hand, you know, I used to love work. It was my life. You know, I used to love my job. You know, I used to work, you know, hard, and it was a good job. But to come out that cocoon and then just to come into four walls on your own, like 12 months later,
yes,
it was a massive psychological problem, and that's when I had some really bad days.
Yeah. Now, what did you do about that? Was there any solution to it?
I went down to my local GP actually, and I seen, like, my local doctor, and we had a good chat, and we came to the conclusion that I would have to go on to antidepressants, which I did do.
Now, one interesting thing there is, did you go to the GP with the idea that depression was becoming a problem, low mood, you know, inactivity was your focus to go and get help?
I think it was
or was it more of a chat and it came up that is definitely a problem?
No, I think it was the inactivity that, you know, really set me back from being mobile and then not mobile. It was a big thing, and that, you know, and that did me head in a lot, to be honest with you.
And your GP suggested you start an antidepressant at that time.
Yeah.
Was that the main treatment for the depression at that time?
Yes, at that precise time it was, yes.
Because I know later you also had some input from our team, but that's very recent.
Yeah.
But at the time it was mainly the antidepressants.
It was, yes.
And did you feel the antidepressants worked for you? The only reason I ask is because people have mixed feelings in the, you know, the general population, viewers will as well, about whether they should or shouldn't take them. You know, what are the pros and the cons?
They've helped me, to be honest with you. They've lifted me. I'd say they've lifted me 30-40%, to be honest with you. You know, they've worked for me. You know, and you know, I have felt generally better. But you know, my biggest problem is I had to take a step further then and get some more help. That's, you know, when I asked to see yourself and, you know, come into Leicester Royal and have a chat with yourselves. You know. Now
we know those teams like ours, the specialist psycho-oncology teams, they're not always available in every service and every hospital in every country. You know, it's very patchy. But it sounds like you are advocating trying to get help for the emotional side as well as the physical side.
Yes, I
not
did,
just perhaps leaving that side unattended, which is sometimes a temptation. You said, particularly for maybe a man, it's hard to talk about it. You know, sometimes these things creep up on you gradually, don't they? And you're not sure, is it a failing that I'm not coping, or is it, you know, is it perhaps a normal part of the illness? You know, it's hard to know when is that threshold coming, when it's time to ask for help. But it sounds like you're an advocate of asking for help in a prompt way.
I did ask for help straight away. I knew there was a problem. I could tell when my own mind was changing. You know, I didn't look the same at that, you know, specific time anyway. I had no hair, so I looked a different person. I'd lost a lot of weight and everything, and you know, and I was really low. There, you know, there were dark days. Literally, there were dark nights and dark days, and you can really get, you know, easily get drawn into, you know, to a situation you don't want to be in.
Now, one thing we haven't talked about yet is chemotherapy and radiotherapy, which was given after the surgery for you, before and after.
Before and after, yes.
So you had kind of both. And the chemotherapy, how long was that for?
I initially started on the chemotherapy in the August. They were aiming to operate on my leg in the October. And I was always told if, you know, that was successful, the chemotherapy, that was the target date in October to go down to Stanmore to have my operation. So I had 3 sessions of chemotherapy here at Leicester in the chemo suite. I used to come in for 4 days at a time, and then have a 2-week break, and then come back. I had an Hickman line put into my chest, so it was more easily to get the chemotherapy in. For the first 2 sessions of chemotherapy, I'll be quite frank with you, never really affected me. The first one certainly didn't, and the second one I just felt a little bit sick, and I thought to myself, I'm going to be fine with this. If this is what it's, you know, going to be about, I'll be able to handle this. And then I went to my 3rd one, which is like the beginning of October in 2012, and I was really poorly. That really hit me then. And that's, you know, when it, you know, really upset me. You know, digestive system, all my eating habits changed. Like, I didn't like tea, I didn't like coffee, I didn't like roast dinners. I wanted to go back to childhood food, what I used to eat as a teenager. Ravioli on toast, tomatoes on toast, quick snacks I had as a kid, which I haven't had for years. And my brain changed. Everything changed in my mouth. My appetite changed, and I went tomato-based, to be honest with you, and I found that helped a great deal, like eating lots of tomatoes. But it did upset me. The chemos upset me,
Was it the fact that your appetite was generally suppressed and you were looking for something that still could prompt your taste in that way, or was it a specific change, you know, in your eating preferences?
Oh no, it was a specific change.
It was?
Yeah, everything changed. Everything. I couldn't even drink a cup of tea.
And was that a temporary thing whilst you were undergoing chemotherapy?
Yeah, it came back.
Yeah.
Thank goodness.
So that was an odd time. Were there any other major side effects from the chemotherapy?
Well, after I had my operation, I had to come back up, and then I went back into Leicester here in the November to have some more chemotherapy, and you know, once again, that again upset me stomach and everything else. So they said they'd stop that.
Yeah.
I couldn't have any more chemotherapy. The tumour had gone. Yeah. Obviously, they were mopping up the remains of anything that was in there, if that's the right word. So they said have a month off as such, and we'll start you on radiotherapy.
I see.
I started on radiotherapy the week before Christmas 2012, and that went on for 35 days of radiotherapy then. So
you had quite an intensive duration, in a way, of radiotherapy.
I did.
And it's a different atmosphere to the chemotherapy suite, isn't it?
It is, yeah.
What was your experience of it?
The radiotherapy is a lot more easier, obviously, to take than the chemotherapy. You know, you're just a case of coming into hospital, and, you know, from an outside point of view, it's just like having an x-ray. Yeah. Walking in 20 minutes and you're gone. You don't know the effects of the radiotherapy until after. And after I'd had my radiotherapy, after the 35 days, it finished in the following February, they kept saying to me down in the suite, like, are you okay with it? You know, my leg wasn't getting red. Like, I knew what was happening. I was also interested in that treatment, and I knew, you know, what was going to happen. I was putting the cream in, after a shower at night, and I was getting better. The scarring was going, and, you know, that wasn't affected with the radiotherapy. And my leg was okay, to be honest with you. And I had no effects from radiotherapy until later. And I got lymphedema in my leg about 6 weeks after. Yes. After I finished radio. Because
that can be an uncomfortable side effect, can't it?
It can, yeah. And unfortunately, it is one of them side effects you can get with radiotherapy.
Let's go on to a little segment about lymphedema. So the lymphedema you mentioned there, what is lymphedema?
Well, lymphedema is a swelling of, like in my case, of the leg.
Yes.
Where I had my operation, it had, become inflamed and infected at the bottom, but it had really come up like a balloon, really, and it was, big problem with swelling and horrible, really.
How long did it last for?
About 3 months, 2 to 3 months. I had to go for specialist treatment on that, where I had to have a stocking fitted to compress the leg.
Yes, and any other treatments, for example, activity-based?
I got an infection in the leg at the same time.
Did you?
And they said, like, do lots of walking.
Yeah.
That was the big thing. Stanmore, down in London said, you must keep exercising your leg now. So you'd gone from one routine where you hadn't been exercising your leg to, like, actually getting the leg moving now, because you had to move the lymphedema away.
Yeah. Was that effective for it?
Yes, it was. Yes,
eventually
it worked for me. Yes, after after a few weeks it had gone.
Yeah.
So that all quickly cleared up. Thank goodness.
Yeah.
The infections, I've had 2 or 3 infections, which are not common practice to have after operations, but antibiotics also cleared them up.
Now, I heard you had some other awkward side effects as well. We haven't mentioned one, which is very, very common, hair loss, and weight as well, and another one is fatigue. So start with the hair loss. Was that a big problem for you?
Yes and no. They said when I was diagnosed that I would lose my hair, and to get a baby brush for my hair, and which I did. And my hair just went, like, all of a sudden. Although I didn't see it disappear, it wasn't on the pillow, it wasn't in the shower, it wasn't in the bathroom anyway. It just went all of a sudden, really. In a matter of 2 or 3 weeks, my hair had gone.
Yeah.
And then my weight loss, that went with it, and my appetite went with it as well.
So what was your normal weight?
My normal weight, I'd be around about 16 and a half stone.
And then you lost how much?
I lost 2.5 stone, came down to 14.
Yes. So that was quite a significant weight loss.
Yes, it was, yeah.
Did you feel unwell with that weight loss?
I did, yes, and I knew I felt weak with it as well.
And did you feel that you were trying to compensate, but it was a struggle by eating? Because I know you said earlier your appetite was affected.
No, I couldn't eat anything.
No, so your weight loss was perhaps driven partly by the low intake, and you were struggling to maintain it. Did anybody ever feel that you needed to have top-ups? That's things like nutritional drinks or foods.
They were all mentioned to me, but I didn't. I didn't really take to any of them really.
No,
it wasn't for you. It wasn't for me. No, not the milky drinks. I'm not a big milk drinker, so I couldn't really take to them.
So how long until the weight stabilised?
It came back. It stabilised after after I'd finished my chemotherapy, and when I got more mobile and I was coming in and having radiotherapy, I felt more confident, and my eating came back into being as such, and I felt a lot better after Christmas then, and I was got back to normal.
How long after the end of the treatment was that?
About 2 or 3 months.
Yeah.
I'd say a couple of months, you're back to normal, your eating habits come back to normal. Tea and coffee was the biggest thing, to get back into your system.
I was going to ask you, are there any residual effects that you feel haven't corrected from that time that were caused then but never corrected?
No, I don't think so. Everything, my hair's come back safe, that's fine. That's been cut, a few times now over the last few months. That's, great.
Yeah.
They said it would come back, it has done. And of course my weight's come back.
Yeah.
Gone from one extreme now. I've put about 4 stone back on, which it's not a bad thing, but I'm going to sort my weight out when I get off my crutches.
Does that mean you've put on too much this time?
Perhaps I have. Yes, I have, to be honest with you. I'm about 17.5 stone now, so I could do with losing a little bit of weight.
But you are using your crutches quite regularly. It's hard to be expending that normal amount of calories, isn't it?
It is, yeah.
Burn off the weight, so to speak.
Yes, it is. You have to watch what you're eating.
One thing I nearly always ask people is, imagine a new patient watching this for the first time, maybe somebody with your condition or a similar condition, who's facing a lot of uncertainty. They've just had the diagnosis. Given your experience, is there anything that you could say to them that you think would be an important message to hear at this time?
Well, initially you're going to be very, very, concerned and worried. Obviously, if you've just been diagnosed with, with anything like this, you're going to be really worried. But just do as you're asked and you're told to do. Go along with your oncologist. This is a great place to go for treatment. Leicester is, and I personally I've had no issues whatsoever, and I've just gone along with the flow as such and done exactly what the nurses and everybody's told me to do, and you'll be okay.
And anything about the attitude in terms of the asking for help? I'm not recording this bit, hang on a second. Or the focus on information? You can just say something to that and I'll just clip it together.
Yeah, keep asking for any information that you want. There's lots and lots of booklets out there, and Macmillan are great, and keep asking for the information, and go down to the bookshop down in the Osborne building and get as much information as you can. And if you don't ask, then you don't get. It's as simple as that, really.
And would you advise people to sign up to support groups or?
Oh yes, most definitely.
People are nervous often about going along to those things.
Well, I was initially, but I'm the only male at my local support group,
Yes.
Whether that's a good thing or bad thing, I don't know. There's like 15 women and myself, but just go, walk in. They're going to be great to you, and they will really support you all the way.
And in fact, people don't know whether they should go to one that's specific about their condition or whether they should go to one about cancer in general. I think you've been to one about cancer in general because your condition's quite rare, let's say. But did you still find that applicable to you?
Yes, I did. Yes, if you go to Cancer UK, they'll send you to the sarcoma, part of it anyway. So do what you think's best for yourself.
Yeah.
But you must utilise the network that's out there, and keep asking the questions.
Very good. Thanks. Something that people often underestimate is the effect of the illness on their nearest and dearest. What has been the way your wife and your family have coped themselves? What have you noticed?
My wife, when I was initially diagnosed, she really was worried. She lost a lot of weight herself. She was really concerned to the effect where it did affect her, to be honest with you. It did affect my wife a lot, and she was the rock really behind me. Although I've got close, family as well, and close connections where I live, and lots of friends. Everybody was coming in on a daily basis as such, or every other day, and ringing up.
You had a good friendship circle then.
I did. I had a big.
They
I had
were
a big
rallying
circle.
around in a sense.
I had a big circle, particularly at work as well. As I said before,
Contacts.
I had lots of contacts, and I wasn't seeing them contacts, and some of them contacts I'd been known to them for 15, 20 years, and they were really concerned for me.
Yeah.
So of course they were texting me and ringing up and keeping in touch.
So
and
a lot of people around you giving you encouragement, and I'm sure that helped.
Oh, it did help.
Even though you were facing that awkward transition where you relatively had less input from the hospital.
Yeah.
But that was partly compensated by the people around who were around you.
Yeah, it was most definitely. Yeah.
Now, were they able to give you input on a practical level or social level during the days when you were off? Because that's a long period of time when you're off work.
I needed help with both really, from a practical level and a social level. Perhaps more, on a social level.
Maybe, yeah.
To be honest with you, because I used to chat to lots of people every day, and
so how well were they able to?
Oh, they were great. They come and speak to me. People would come round, and my door was always open as such, and I had a good base of friends and family.
And were they setting the right balance between coming around, being helpful, doing something, talking about non-ill health related things, and conversely, sometimes being too much, too intrusive, and not letting you have your own independence or autonomy,
No, not really. Like, I used to enjoy them coming round, and as I said before, I was involved in my treatment. I wanted to tell people what I'd had done, because from a pride point of view, I felt proud that I went through this operation, if that's the right word. I was pleased to come out the other end, and I told lots and lots of people about this operation, and I've learned, lots of things about cancer as well, and I've, passed that on to people, particularly, the female friendships, in the family as such. I can talk about breast cancer now to women.
Yes.
I can talk to all sorts of.
So the word
people.
Cancer then, it doesn't hold you back. It's not a big like a burden for you. You use it in a positive way to see how you can help others. Sometimes.
That's right. That's that's correct. Just because you say cancer, it's not a death threat. It's it's just parcel of life. Unfortunately, 1 in 3 of us are going to get it. So that's what they're saying, aren't they? So you've got to face up to that.
Yes. And have you actually been able to do that practically with anyone that you've met? For example, have you met any patients going through a cancer journey you met along the way?
I have, yes. I've met lots of people, particularly sitting in the chemo suite up here at Leicester.
That's what I wondered, yeah.
Yeah, you see lots worse than me. I remain positive and strong, and I was going to come through this, but lots of people have, you see a lot of people worse off than yourself.
There are people who are worse off, but there's also people better off. Sometimes people don't want to see anybody different to them, because they don't want to see anybody who's worse because they think that might be them, and they don't want to see anybody better because that's not them at this moment. Do you see what I mean?
Oh yes, I do. Yeah.
But could you handle that?
Yes, I could. Yeah, I could.
Stages of illness.
Yes, I could.
Did any of those people stay in contact with you and become a friend or?
Yes, they have, particularly from down Stanmore.
Yeah.
I've gained some friends from Stanmore who have had problems, and we email and speak on the phone.
Yeah.
quite often.
Was there ever an option to do anything in an organised sense? For example, a support group or drop-in or something?
Yes.
Even online you can do it these days.
Yes, you can.
But did you ever come across anything like this?
Yeah, I've joined Sarcoma UK, through the hospital here at Leicester. And then I've also joined locally like an hospice group, like Hospice Hope, which are based in Ashby de la Zouch, which are like a meeting group on a Friday, where they have patients in who have got and had cancer. So I go there every Friday afternoon for a couple of hours for tea and coffee, and we have a sit and chat, and everybody swaps their stories.
Do you find that helpful?
Greatly, yes.
Yeah.
I do. I love going there because you can share your experiences with with people that are just starting off on the journey, or like me on the other side of the journey.
Yeah.
And at this moment in time, there's people who are coming in, particularly women who have just been diagnosed with breast cancer, and they've started off with the treatment. You can speak to them and tell them what they're going to go through and how their appetite's going to change and how they're going to feel, and
So you feel there's a lot of useful contact there, not just information but emotional support.
Yes. Yes, most definitely. I think it's the emotional support that everybody wants.
Because a lot of people would otherwise feel perhaps on their own with this condition. They're getting help medically, but it's not the same as feeling somebody's there with you.
No, it's not. No, it's not.
And not everybody has that friendship or family network that you.
No, they don't. There's, as I just said, there's always somebody worse off than than yourself. So I do feel for them people.
Yeah.
I even know where I live now. People who are poorly with cancer. But
And you told me, I think, that you've actually started to do some volunteering.
Yes, I'm actively involved where I live with several projects. I'm involved with the local parish council, which I joined up a few years ago before I was diagnosed with this. So that's been ongoing. So in the daytime now I'm at home on my own. That keeps me going.
Yes. You developed a role there.
Just it developed a role and keeps me going with emails and work, and I do some funding applications like on behalf of them. We've just done one for £100,000 to get a skate park where I live, and then we've done another one for £50,000 to upgrade like an all-weather pitch.
Brilliant.
So I've been able to do that on the internet and help with that. So
that's really great.
That's been great. And then I've just helped organise the local Christmas lights switch on and put all the lights up in the street, sorted that out. So, I like to keep my mind active. I really do.
It sounds like you've got a developing role that's really valued by the community there.
Yes.
And that can be really important for somebody who was previously working very hard and then had to give that up.
Yes, it is. Yeah, it's been a godsend to me, really. I call it my charity work as such, but I wouldn't be without it now. I like being involved in the local community, and it keeps me going as such. I don't know what I'd do without it now, to be honest with you.
Yes.
And I'm also taking it a step further now. I'm going to be meeting with Macmillan later on this month to see if I can do anything, on a fundraising role, or from a counselling role. I don't know.
I'm sure there'll be opportunities there.
I'd like to think there is.
Now, all told, do you feel that you've got sufficient on now that you don't think so much about that old job that you had, that you were forced to give up? Because I'm thinking, you've got all these valuable roles, but you did have all those amazing contacts and all those early morning starts, that routine and everything going. What do you think, comparing and contrasting your life now?
Very good question, actually. I often think, in the days now, what I should really be doing, or what I was doing 2 or 3 years ago. I was here. I should be there. Now I'm not. I'm in a different role now.
Yes.
I feel like I've done my working role as such. I've been involved with the working environment, and now the last 18 months I've been in the hospital environment, and now I want to move on from them two parts of my life and go into another part of my life.
Yes.
And that and that's what I'm going to do.
It could be a new phase for you.
Could be a new phase for me, but it's
Indeed. What do you see in the future for yourself?
I see you know, I see positivity all the time. I'm not, you know, not a person that's going to go backwards. I want to go forwards, and just because, you know, this has happened to me, you know, it's not going to stop me doing what I want to do in life. I want to travel a bit more, you know. I want to, you know, to do things at home and, you know, improve, you know, things in, you know, in my local neighbourhood, which I'm, you know, actively involved in. But on the other hand, I also want to help like other cancer patients, because I've got, you know, a lot to give to them, and, you know, like tell them, you know, lots of stories and what I've been through.
Yeah. Well, Colin, I think you've come a very long way actually already, and you've had a start which was tricky regarding what seemed to be an innocuous lump and turned out to be something really very serious. You had that amazing operation which was really cutting edge, involving a specialist centre and all that kind of rehabilitation work, which was, you know, a long hard slog in a way. And although you had that big initial setback of the change in role, you've replaced a lot of what you did with a different but yet equally valued role, I think, for the community. All those things that you're talking about now will be seen as tremendously positive. It gives you something that's positive, but it gives all those people who you're working for something that's positive as well.
That's right.
So all in all, I think it's a very inspirational and positive account of what can happen even after a cancer diagnosis, which of course is still feared by the general public.
Correct, yeah.
And I think anybody watching this will benefit from hearing your story. So I want to thank you for coming in today and sharing your account. It was really valuable.
No problem.
And I wish you all the best for the future.
Thank you very much. Thank you.